the mental health adverse consequences of marijuana are frightening in and of themselves, but there's also, are there not physical health consequences of using marijuana that maybe don't get as much attention, but we should dive into that. What do you see as the physical health consequences?
Oh, absolutely. And when I talked to the gentleman on Kello, and he said that maybe some of my data is outdated, I want to emphasize that these are all current medical studies and publications. So there was a recent study with 379,000 patients, non-smokers, all of them. And it showed that the marijuana smokers had an approximately 80% increased risk of heart attack and stroke, or heart attack and coronary artery disease, and an 88% increased risk of stroke. You don't hear that in most of the literature out there. And I think that as the United States does more longitudinal studies, we will see more of that, but the international community has known it for a long time. There are something called hyperemesis cannabis. It's a condition where the lining of the gut gets inflamed from the marijuana use, and they have this uncontrolled vomiting. It doesn't stop until they stop using completely. They call it scromiting, because these people come into the emergency room frequently screaming from the pain as they vomit. And I saw a significant amount of that in my practice. And, they never want to believe that it's marijuana. But doc, the website tell me that it'll help with nausea. And I say, well, not for you, it certainly doesn't. And until they stop using, they don't stop vomiting. There's something new out there that they are beginning to see with the high potency called cannabis arteritis, and it narrows the arteries in the digits. It may be similar to something that we see in cigarette smokers called Berger's disease, but they can lose digits. It's rare at this point, but I think with the increasing potency, we may see more of that. It has an increased risk of testicular cancer. We know that.
Oy.
That has been proven. I suspect that the longitudinal studies in the United States will show increased risk for multiple other cancers. I know that recently the CDC said that the tar and carcinogens in marijuana is actually higher than it is in cigarettes.